Thank you so much for the wonderful introduction, and thank you so much for the opportunity to speak today on fear of missing out, part-time surgery, as well as the financial independence, retirement, early lifestyle movement. Sorry, just getting the mouse to work here. Thank you. So I do not have any financial disclosures. I am a 0.8 FTE and not a financial expert by any means. I hope to share with you a bit about how my career has evolved in hopes of not missing out on really anything in life. And I also am a Generation X and not a millennial, and I did have to actually Google the title of this talk. So part-time surgery. Millennials are projected to take up to 75% of the workforce by 2025. And with this, changing attitudes about work-life balance have unfolded, and there is a trend to working part-time. In medicine, part-time models are very well established. There are job share opportunities as well as fractional FTE opportunities, locums, and hospitalist medicine. In surgery, however, part-time models are not well established, but they're definitely gaining support. Over the past decade, acute care surgery has been on the rise. It's really the closest model that we have to the chance of being part-time within surgery. And it has shown that it's increased patient access, patient outcomes have been excellent, and it's also improved not only productivity of ACS surgeons, but also their happiness. There was an article in the American College of Surgeons back in 2011, which actually cited the value of offering part-time models for employment of mid-career women, as well as retiring surgeons to reduce the shortage of surgeons. The work shortage expected with surgeons in the future. And in the article, they promoted models that address flexible work schedules, malpractice premium adjustments, academic promotion, maintenance of certification and licensure, and employment benefits. So my life now, I'm a general surgeon at Leahy Clinic since 2011. I technically am a 0.8 FTE. I work Monday through Thursday with Friday off. I take 24 to 36 hours of in-house call per month on the weekend. I'm the only female of 6 elective general surgeons and 3 ACS partners. My practice focuses on abdominal reconstruction, thyroid and parathyroid surgery, bariatric surgery, and surgical education. I have an additional 0.1 FTE offset for my work as a co-associate program director, and I serve on several committees. I've been married since 2011 to another surgeon. I have a 5-year-old and a 6-month-old daughter. How did I get here? Well, I trained in general surgery at Leahy Clinic. I absolutely fell in love with Leahy Clinic as well as the general surgeons in that department. I did a year of plastic surgery training thereafter, thinking I was going to be a plastic surgeon, but I really just realized I couldn't leave general surgery. A job opportunity opened up in 2011 to join the faculty, and it was really just the perfect environment for mentorship, lifelong learning, and practice development while having a family, though being a part-time surgeon was really not my intention. When I started as a full-time general surgery staff member. A third of my practice was ACS and 2/3 was elective. This fulfilled the need in the department because acute care surgery was on the rise and we just were that busy. In 2014, I had my son, and prior to my departure to maternity leave, I had had wonderful mentorship from the current chief of surgery at the time, Dr. Patricia Roberts, who was actually mother of 3 and married to one of my partners, Mike Rosenblatt. She discussed and advised me to take several vacation days per week upon my return from maternity leave to kind of feather my way back into the workforce and transition nicely. This kind of put the idea in my head to maybe work part-time permanently thereafter. I then proposed that model to my chairman at the time, Dr. Desmond Burkett. He was endlessly supportive and actually got this approved, and I owe him a lot for that. Essentially, after I had my son in 2014, I returned, quote-unquote, part-time. I worked 3-day, 4-day, and 5-day weeks in order to make it work. I would schedule my time a month or two in advance in order to still fulfill the needs of the 5-day work week for the acute care surgery service, but also still stay part-time and honor my time to myself as well. I then had my second child just at the end of last year. I transitioned out of acute care surgery and actually added bariatrics back into my practice with the assistance of my wonderful partners. I had my child and came back this year and am now just only elective as a part-time surgeon working Monday through Thursday. So what does part-time look like? Well, work days are sometimes longer. It includes dictating after hours, conference calls on the days off, calling patients, and coordinating care when I'm not there. Sometimes I round with my children on Fridays. I take call on the weekends still, 80% as much as my partners. This came with a off the top 20% salary decrease, 20% reduction in my vacation time, and a higher cost to my health care because of my quote-unquote part-time status. Initially, my RVU production was well over a 1 FTE equivalent, working 4 days a week. What does part-time look like at home? Well, it is the best day of the week. I can't really put a price on this. I don't think anyone can, and if anybody's a parent in the room, they understand immediately. But I try to make the day as special as possible, and I don't think about the money. What are the keys to making it work? Well, a wonderful husband. He's a surgeon as well. He understands implicitly that being a good surgeon is not punching a clock, and certainly being a wonderful mother isn't as well. My mother, my best friend, she's simply amazing. She's taken care of my son since the moment he was born and has been there every day to take care of him, even with my ever-changing schedule. What's the other key to making it work? Well, outstanding partners. I really can't emphasize this enough. These are not all my partners, but these are the core. And all I can say is that these were selfies I took the week before this talk. They all include pictures of their children. Don't let the gentleman without the pictures fool you. He's a past president of SAGES, and he's very much a family man. But at any rate, they're all wonderful and loving husbands and fathers. They've been totally and utterly supportive of me with my part-time approach. I've always been given leadership opportunities, and I've always been treated as an equal. Strategies. You need to pick the right environment. You need to be flexible to allow your interests to align with department needs. You need to try to rally for appropriate compensation that rewards production regardless of time. This wasn't how it started for me, but we have moved to an RVU-based compensation approach, which will certainly help in the future. Health benefit reimbursement has not been addressed. You need to advocate for yourself for pay raises and promotions when due. Optimize your work schedule, which really means sometimes doing OR cases earlier in the week so that you have time to round on those patients before your day off. If you do have leadership positions, try to rally for an FTE offset so that you actually are rewarded for your time, but also have flexibility with your scheduling. Stay busy so that you feel valuable, and be busy so that you're viewed as valuable by others. And if you choose time over money, protect your time and make the most of it. So with the few moments I have left, and this is only 2 slides to the gang to my right, FIRE is the Financial Independence Retire Early Lifestyle Movement. All I can say is that in a nutshell, you need to acquire assets, increase income, or decrease expenses such that 4% of your assets are sufficient to cover a year's expenses indefinitely. Upon reaching financial independence, paid work becomes optional, allowing for retirement from traditional work decades earlier than standard retirement age. The reality is that the age you retire is so highly individual, depends upon the rate of savings, your income after taxes, when you choose to retire, and how you spend your retirement. And I'll just say that our strategies are to maximize retirement fund contributions, maximize education, a 15-year mortgage, and enjoy the moment. So in conclusion, being a surgeon can happen without missing out. You got to approach both work and family with full love and commitment to do both well. Find the right environment, define your priorities, and be flexible and creative, but don't lose sight of your interest and goals. Thanks.
Thank you.
There you go.